Today we'll talk about a very important medication that is underutilized in the treatment of diabetes and in the treatment of cardiovascular disease. This medication is the flozins, empagliflozin, SGLT2 medication inhibitors. Why this medication is very important? Because it actually prevents the kidneys from absorbing back the glucose that is filtered in the urine. The kidney actually spends energy, ATP, which is the energy it needs to absorb back the glucose from the filtrate of the urine. And in this process, actually it tries to absorb most of the filtered glucose to provide more energy to the body. But most people actually do not need this extra work from the kidney. So these medications actually block this process of active transporting the glucose from the urine, and by this they provide the caloric deficit. So the body will act as they need to provide more energy. They will burn more fat to provide more glucose. Burning more fat, particularly the visceral fat, which is the fat that is deposited over the organs, between the intestine, over the liver, over the pancreas, over the kidneys itself, over the heart. There will be deposition of fat. And this is the most dangerous fat on the body that eventually will accumulate in the arteries and veins and cause other types of cardiovascular events, blockage, stroke, heart attack. So these medications are very efficient in decreasing the caloric load and also decreasing the workload on the kidneys to absorb more glucose back to the body. So they in fact protect the body from extra energy and also protect the kidneys from using more energy, from using more oxygen to absorb back the glucose, which actually on the long term provides protection mechanism and provides less degradation of the renal function over the years. So this medication is very important in also lowering the pressure inside the kidney and also decreasing the energy that is demanded by the kidney to properly function. So I strongly advise for the use in these medications in the management of diabetes and also in the protection of cardiovascular diseases.